Kenyans could be staring at another doctor's strike in the coming month after KMPDU called for a special delegates meeting to issue a strike notice. Now, the union says that it has been necessitated by the government's failure to implement the return to work formula that ended the 56-day strike earlier in the year. The union has already asked all intern doctors to withdraw their services from public hospitals immediately, citing poor working conditions and non-payment of salaries that have driven some of the young doctors to suicide. Let's begin our broadcast with our very own Brenda Wanga.
They took to the streets of Thika town, spurred by the death by suicide of one of their own. Dr. Francis Njuki, aged 29, was until his demise a pharmacist at the Thika Level 5 hospital. His body was discovered hanging from the roof of his rented house in Kiganjo Estate on Monday.
Kaeza kuprocess, alafu ndio kaeza kutoa hiyo mwili na ikapelekwa mochari hapa Thika Level 5. Baadaye ndio siku ya jana Tuesday mwili iliweza kufanywa postmortem.
Until his death, Njuki suffered a fate similar to that of his demonstrating colleagues, working without pay for 4 months. The doctors' union says his death is just one of many such cases and attempted suicides by intern doctors. In September, yet another intern, Dr. Desire Mora, also committed suicide.
This now brings a total number of 2 interns who we've lost in 2 months under the same similar circumstances. I'm also aware of 5 other interns who have attempted suicide. Unfortunately, were rescued and hospitalized.
The union has now stepped in to stem what they say is the exploitation of intern doctors by the government.
We are asking all the medical doctor interns across the country, in all the facilities, to stay at home immediately.
The union accuses the government of failing to fully implement the return to work formula that was signed in May, bringing to a close the 56 days strike by the union. That agreement, amongst other things, would have seen doctors get their basic salary arrears, harmonization of the salary scale of doctors, and the provision of medical cover, as well as the posting of intern doctors.
Because Kenyans are being put in a plane where the pilot, who is the doctor, is suicidal. But the airline tells you that they have insured the plane, they have fueled it, and you, the patient, should trust yourself to fly with this sick pilot.
The union says the failure by government to hold its end of the deal will be costly as another strike looms.
We're going to give now notice for the nationwide strike of all the doctors. We have the SDC or Special Delegate Conference, which then will determine whether we're going for 7 days or 14 days, or at most 21 days. But I believe because of the urgency of the matter and the frustrations that there is with the doctors across the entire country, we may not go beyond 14 days.
If the doctors make good their threat, the country will witness an unprecedented second doctor strike in 1 year, further impacting the health sector that is already grappling with the change in systems in the transition to universal health coverage. It may also affect learning in the health sciences at the university level. Brenda Wanga, Citizen TV.